might wonder how long after sexual intercourse you can take a pregnancy test. I mean, who wouldn't be curious about that?
Right, especially since getting the most accurate result is crucial. Did you know that the best time to test for pregnancy is actually a day after your missed period?
Really? I always thought you could get an immediate answer.
Well, some early over-the-counter tests are sensitive enough to detect pregnancy a few days before a missed period. They can give you a result in minutes.
That's fascinating. But what types of pregnancy tests are there, and how do they work?
Great question, Luna. There are mainly two types, urine tests and blood tests. Let's start with urine tests. They check for a hormone called human chorionic gonadotropin, or HCG. This hormone is only produced during pregnancy.
Oh wow, that's why it's called the pregnancy hormone. How soon after ovulation can you detect HCG?
If you have a 28-day cycle, you can usually detect HCG in your urine 12 to 15 days after ovulation. You can take a urine test either at home with a kit or at a doctor's office.
That's convenient. But are there any downsides to urine tests?
If you test early, like before 10 days after conception, you might get a false negative. So if you test early and it's negative, but your period still doesn't come, you should test again.
Hey there, health enthusiasts! If you're enjoying this juicy conversation, don't forget to smash that like button, subscribe to the Health for more awesome content, and share your thoughts in the comments. Now back to Luna and Susan.
Well, that was fun. Now what about blood tests for pregnancy?
Blood tests are less common because they're more expensive, but they can detect even tiny amounts of HCG. Doctors might recommend them if you have a high-risk pregnancy or if you're undergoing fertility treatments.
Interesting. So they're more for specific cases. What are the types of blood tests?
There are qualitative and quantitative HCG blood tests. The qualitative test simply indicates whether HCG is present, while the quantitative test gives an exact amount, which helps in understanding how far along the pregnancy is.
Timing seems crucial for these tests. What's the best timing for a pregnancy test?
Yes, timing is everything. The best time to take a pregnancy test is after your period is delayed. If you can't wait for your period, test at least 1 to 2 weeks after intercourse.
That makes sense. But what if you're not sure about the timing of ovulation?
Good point. Tracking your cycle can help. There are also ovulation test kits and basal body temperature tracking methods you can use.
So early morning is the best time for a urine test since the urine is more concentrated.
Exactly. First morning urine has the highest concentration of HCG, especially in the early stages of pregnancy.
What about if you feel pregnant, but the test is negative?
Oh, if you have early pregnancy symptoms like breast tenderness, mild cramping, or fatigue, and get a negative test, talk to your doctor. It might just be too early, and the HCG levels aren't high enough yet.
And for those super early testers, are those early pregnancy tests effective?
They can be, but there's a lower chance of a positive result. Early testing can be important for starting or stopping certain medications or making lifestyle changes. Most tests are about 99% accurate on the day of a missed period.
Don't forget to subscribe, and hit that bell icon for the health updates. We love hearing from you, so drop a comment. Now let's wrap this up.
Thanks, Alex. So, in summary, the best time to test for pregnancy is after a missed period, whether you're using a urine or blood test. But remember, always follow up with your doctor for the most accurate information.
Absolutely, Luna. And thank you everyone for joining us today on To The Health. We hope this helped you understand the best times and methods for pregnancy testing.
Until next time, stay curious and stay healthy.